In today's presentation, we will be talking about self-advocacy in healthcare. First, I'll go over the agenda. We will define self-advocacy and what it looks like in healthcare, define personal health literacy and its relationship with self-advocacy, establish the importance of self-advocacy in healthcare, explain the relevance of self-advocacy in the COVID-19 pandemic, set responsibilities for practicing self-advocacy and acquiring personal health literacy, and finally, we will go over some tips and advice on how to practice self-advocacy and acquire personal health literacy. So first, what is self-advocacy? Self-advocacy is the action of having your voice be heard and asking for your needs to be met. And what does this look like? So this can look like you knowing your rights, speaking up for yourself, and knowing your needs and making informed decisions about how to meet them. So, in order for you to be able to advocate for what you need to understand exactly what it is that you need and understand what you're entitled to when asking for those needs. Now, how does self advocacy in healthcare look? So, this may look anywhere from being able to choose or change doctors, being involved and informed when creating a plan about health services you will receive. And this can be anything along the lines of planning for vaccines you want to receive, when you want to receive them, or any other procedures that you have to undergo that may be a little more complicated. This may also look like being informed about treatment and services available, making informed decisions about when to turn down or request care, and having information and written records presented to you so that you can understand them. In the previous bullet point, I described practicing self-advocacy as having information presented to you in a way that you can understand it, which ties to our next topic, which is the relationship between personal health literacy and self-advocacy. First, I'll start by defining it. So the CDC defines it as it is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. I'll start off by going over some facts. First, healthcare providers are not aware of patients' health literacy and will use medical jargon to shorten communication. Also, healthcare providers have different sets of biases that influence their interactions with patients. So, to briefly go over this, many times medical practitioners do not present information in a way that's easy to understand. And based off the vocabulary and the jargon that they may use, it oftentimes makes it more complicated and it's not as efficient as they think it is because many times they will just communicate it to you the way they would communicate it with other practitioners because they think you will understand. And oftentimes it just causes more confusion. And also, many times they have biases and they may be unconscious. And so, this is why it's important for you to actually understand the information that you need to have access to in order to make decisions and also for you to self advocate. So, now, health literacy is important because it determines a patient's knowledge and quality of information regarding health topics. This includes knowledge and information about best practices for self advocacy and about making informed decisions. So, why is self advocacy in healthcare crucial? First, a patient's knowledge, experiences, and concerns need to be understood in order to deliver effective healthcare. Also, it is important for a patient to feel like they're being treated with dignity, respect, and with consideration for privacy, most importantly. And negative healthcare encounters make patients more likely to avoid healthcare services and not remember important information in the future. So now to briefly go over how this relates to the COVID-19 pandemic. The pandemic has made it more evident that there is a need for accurate information and resources to advocate for healthcare. Many vulnerable populations, and this includes people with disabilities, migrant communities, elderly people, people facing homelessness, people facing poverty, etc. These populations are more likely to be infected and die from COVID-19, and this may be a result of inequitable access to healthcare, and this may be vaccines and treatment, and also just information about how the virus can be contracted and how to prevent contracting the virus. So, one of the things that I wanted to discuss is how to hold yourself accountable. So, what is it that you are responsible for when trying to practice self advocacy and acquire health literacy? So, these are a couple of bullet points of things you are responsible for. One of them is choosing a primary care physician, provider, and clinic. So, this is probably one of the most important ones because you need to make sure that the provider you're going to or the clinic, hospital that you're visiting is able to meet your needs. The next one is setting up your own doctor's appointments, being on time, and also canceling or notifying the doctor's office in advance if you will be late. These all can help a healthcare system run more efficiently for everyone, even just yourself, because you are able to have some sort of say in how your appointments are going to go and when you are able to make these appointments. Also, giving accurate information during your consultations is crucial because this will affect the amount of decisions and the way doctors approach your situation. Using healthcare services appropriately is also an important responsibility because you want to make sure that you're not overusing resources or misusing them. If you have something that you can see a physician in a clinic for, you can ask your clinics if they do walk in so that you're not, going to an emergency room for something that you can easily just, go to a walk in appointment because this would also reduce costs for yourself. Another one is being respectful when voicing your thoughts and concerns. And this is important when setting and establishing a good relationship with your physician. Also, following your doctor's orders. So, you are responsible for asking questions and seeking clarification and help. You are the only person in control of what you know. So, by asking questions, you can give your doctor an idea of where you are and how they can support you. So, for the final slide, I want to go over some tips and advice. The first one is speak up, ask clarification questions, and voice confusion and concerns. This will allow you to obtain all the information that you need and ensure that you are understanding everything well and have access to all of the information necessary for you to make informed decisions. The next one is know yourself and work towards feeling comfortable about sharing information, opinions, thoughts, and ideas. This will help in ensuring that your healthcare provider is aware and comfortably acknowledges your experiences and identities. And making your provider aware of these things is important because this will help them better address your needs and cater their healthcare services to what it is that you want and are looking for. The next one is report acts of discrimination and barriers to access to healthcare services. This is also a very important component to self advocacy because sometimes it is easy for people to overlook what is a barrier, and so if you see something as a barrier, it's more likely that someone else does. So by speaking up about these things, it can be addressed. If you're not telling anyone it needs to be addressed, they won't address it. The next one is take notes and keep all written documentation. This is also important for referencing and being able to ensure that you are keeping track of everything that you need or anything that a doctor recommends. Then we have inform yourself about your legal rights and understand them. And finally, ask for help. And this includes knowing when to ask for help. A lot of times you need to ask for help, and this is the next step for you to be able to acquire the services and information that you need. And this concludes our presentation. Now I will open up the floor for any questions or comments that anyone has.